This evening, our trust index examines something Governor DeSantis said yesterday at his news conference. He criticized a model which had predicted how many people could be hospitalized around the state with COVID-19 by the end of April.
So that's the 465,000, way up there for hospitalizations. You look down, 2,111 hospitalizations. So they were off by about 463,000 hospitalizations. Again, that was a scary thing.
News4JAX reporter Kelly Wiley has your trust index this evening and shows us why Florida did not have nearly the number of hospitalizations as the model had predicted.
On Wednesday, Florida Governor Ron DeSantis did not mince words. He said projections for models like COVID Act Now did not happen. He was speaking specifically about projections that were published in mid-March, speaking specifically to the potential impact this virus could have on state hospitals. Here's a portion of what he said.
Projections say the state could run out of ICU beds by April 14th. Very scary. Well, what did happen? Florida's ICU bed availability today, 36.5% of the ICU beds in the state of Florida sit empty.
The projection he's talking about was given in mid-March. It reflected what the model said could happen if no actions were taken to slow the spread of the virus. The same model predicted that with shelter-in-place orders in place for 3 months, by July, there'd be a little more than 18,129 hospitalizations. Figures released from the state today show Florida is still well below that number, with about 5,500 people who've been hospitalized to date. And Governor DeSantis acknowledged later on in this speech that some of the actions that were taken to slow the spread of the virus actually did change predicted outcomes for COVID-19. Actions like stay-at-home orders, bans on in-restaurant dining, and visits to long-term care facilities. In a televised interview last month, Dr. Fauci said this about models that try to predict the outcomes of COVID-19. Whenever the models come in, they give a worst-case scenario and a best-case scenario. Generally, the reality is somewhere in the middle. I've never seen a model of the diseases that I've dealt with where the worst case actually came out. They always overshoot. We also checked the COVID Act Now website now and saw that their predictions have changed based on current trends and what could happen if certain restrictions are lifted. As has the IHME model. That's the one that the White House Coronavirus Task Force has cited before. Dr. Fauci had this to say about why the IHME model has been revised over time.
So even though it says, according to the model, which is a good model that we're dealing with, this is full mitigation. As we get more data, as the weeks go by, that could be modified.
Based on the information that we shared with you, you should be careful when you're looking at models that are making predictions. Dr. Fauci said they are bringing up the worst case scenarios, not always what's actually going to happen. Things can change as new data is brought in, and actions taken like social distancing and stay-at-home orders can change outcomes, particularly like showing lower numbers than were actually first predicted. Reporting in Jacksonville, Kelly Wiley, Channel 4, the local station.